Am I sharing my screen, Nate? Am I sharing my screen?
Yes.
Fantastic. Okay, so based on all the information that we heard, I thought we would start with
Your phone is now
what I think is the simplest way to go. Everyone can see the chart on the screen? Maybe?
Yes.
So CAE devices we know are definitely intense pulse light and lasers. Are there other devices that would be exclusively CAE using the guideposts that we have, which are, it fits in the definition of device, a piece of equipment or a mechanism designed to serve a special purpose or perform a special function, is capable of performing non-ablative procedures on the hair or skin, must be registered with the US FDA, includes, and it shares the same qualities as intense pulse light and lasers. Are there other devices, like off the top, that you would say are a CAE device? And then with that, what would be the common characteristics? Anyone?
I think definitely cryolipolysis.
Right? No. And what would the common characteristics be with, would it be like similar education? Would it be, is there higher safety risks?
I
Or
think
similar safety?
multiple, definitely. I mean, it's inducing apoptosis, which is similar to laser and IPL, safety risks, insurance factors. Most of those machines are required to be FDA approved.
Anybody else have any comments? I'll just go down the list. Deborah?
Yes, I do. Intense pulse light and laser have one common denominator, and that is the risk to skin and eyes, which would certainly be the first thing that I would say is a common denominator, is increased risk to skin and eyes for damage. And now that's the main characteristics that we're looking at.
Would it be the same with cryolipolysis? Same
There's
type of risk?
definitely some major risk.
It doesn't have to be skin and eyes. Maybe it's, well, is there a risk to other parts of the body, maybe?
There are greater risks with cryolipolysis as well. Yes, to nerves, to damage to surrounding tissues.
Bad things, bad things. Sorry. Okay. Are there other, so I have, and I sent you guys a copy, I don't expect you to print it, the curriculum for advanced aesthetics, and I could just kind of go down the list. And if you think one of them should be in the CAE device pile, say so. If you think it could be either or, we could go down, I have a spot for crossover devices. We don't have to get to that today, but if it's possible. So plasma device.
I definitely think that has some major risk factors. There's a very large chance of scarring with plasma and fibroblast.
Yeah, I would agree and say that is an advanced device as well.
I'm going to disagree there, but This is Deborah.
Tell me why you disagree, Deborah.
Because actually plasma and fibroblast is a micro injury on the epidermis that stimulates dermal remodeling below the surface of the skin. And with proper training, I don't believe it's that much different than doing many of the other procedures that are okay in standard aesthetics. I think that if with proper training, it is not as dangerous. But that's just
are we talking about like plasma pen devices and things like that are sparking like plasma arcs and like in that realm? Is that what we're talking about?
You tell me.
Well, that's what I'm trying to understand.
And it's not
okay. Okay.
There's an electrical one that is fibroblast, and there's true plasma. True plasma,
okay.
Yes, it should be advanced, but regular fibroblast, okay. I don't believe so.
Okay, that was agreed. Yes, thank you. That was what I was trying to understand as well.
So tell me a little bit about with proper training, and would that be just for the fibroblast, Deborah, not the true plasma?
I'm sorry, I'm not sure of your question. You mean?
So I hear
they all need training.
True plasma would be advanced, and then fibroblast would be likely COS. Is that accurate? Did I hear you correctly?
In my opinion.
Okay.
Yes.
Going down the list. Lacey Mendoza.
I'm going to agree with Deborah on this one. I think exactly what she said. With the advanced training, fibroblast could definitely be, it's probably going to be a crossover device.
Tell me a little bit about what advanced training means. I mean, is it what they get in school? Is it a subset of their training, similar to like dermaplaning or chemical peels? Tell me a little bit about that.
Similar to any of those things. I mean, any type of certification process would give you enough training that you would need to perform that treatment.
Yeah, usually the training kind of comes along when you buy a device, and then the training, it's usually like a full day or a half day, and you train on individuals, and then you get the all of the information on pre and post care and all of those things on how to educate your patients as well. So it is a pretty extensive training, usually with those devices.
Okay.
And I think another factor.
Wait, I didn't hear. Taylor, go ahead.
I think another factor to think about with this device specifically is, and somebody kind of already mentioned it, was post-care with clientele. There is a very high risk of infection, scarring, post-inflammatory hyperpigmentation. It's a very high risk procedure afterwards.
Is it with the fibroblast?
Yeah, and before the patient selection is very important as well, because if you have any patients with a higher melanin content, you do risk that PIH or potential hypopigmentation. And if you have anyone that is not good at healing or they pick or anything, so yeah, it can be a lot on the patient as far as kind of how dangerous the treatment can be.
And that's the fibroblast.
Correct.
Let's go to our
well, technically both. Yeah.
No. The little fibroblast pins that are on the market are not true plasma. So there is a distinction between those, and I think that needs to be made. This is Deborah. It's not true fibroblast or not true plasma. But there is a certain learning curve, but not any, or as far as not any different than doing a chemical peel, as far as, you know, post care and if with proper training, I believe that you know, it should be fine. But that's again, but there is a distinction between regular plasma and a fibroblast pin that says it is plasma. It's actually an electrical arc.
It's an electrical
not true plasma. An electrical arc.
ARCH.
ARCH.
not a spelling whiz. I can type, but spelling is questionable. So let's just quickly go to our guidepost for CAE. I want to do that. And Heather, if I'm off kilter, let me know. Or if there's questions you have, pop in anytime. So, so does it fit device, a piece of equipment, mechanism designed to serve a special purpose? I think so. It is electrical, has an electrical arc, so I think that fits. Must be capable of being used to cleanse, stimulate, manipulate, exfoliate, apply lotions and creams. Which one of those would the fiberglass pin fit?
Stimulate?
Anybody else have? Any other ones that might be? I'll read them again. Stimulate, manipulate, exfoliate, applying lotions and creams to the human body or face, or cleansing. And so I think this is it similar to galvanic current, high frequency, microcurrent, light emitting diode therapy, and microdermabrasion? Is it similar to one of those, or would the training be similar? Is the safety similar to any one of those stated devices that are already in statute? Like, would there be,
So
is there a
in
risk?
my personal office, we have plasma pen, and we only use that for skin tightening. So that is the skin tightening, and I mean overall that is our goal in our office. We don't use a fiberblast pen, so I don't know if there's a different point for a fiberblast pen. But in my eyes, if we're just using the plasma pen for skin tightening, then doesn't it could potentially fall out of the COS scope?
And to my understanding, our plasma pen that we use, well, our fiberblast pen, I should say, is FDA approved for skin tightening procedures.
Yeah, that's what ours is approved for as well. There's really no other approval for it other than skin tightening, unless someone else like our PA uses it and she can remove skin tags with it, but that's a different scope altogether.
So let me just make sure I understand. The fiberglass pen, which is not true plasma, is approved by the FDA for skin tightening?
To my understanding, it is. That is what it's FDA approved for.
And differently, the true plasma, I'm assuming, can be a pen. And that we think is in CAE is, what's that for? Same thing?
True plasma, to my understanding, is more of a in-depth laser procedure, which I think would automatically fall under CAE because it's very specific. It's not similar to the fibroblast pen. The only thing that's really similar between the two is the wording plasma is used in both.
And it's still used for skin tightening, is that right?
I believe so, yes.
Anybody have any comments about that?
Some of them actually have the FDA registration as a massage therapy or electrical device, not a skin tightening device. It looks like on the Plax pot and some of those.
Well, I don't think it would fit in that scenario. Definitely wouldn't. I don't think it would fit in massage. But is that just some of them?
I just looked up a registration for the Plax pot, and that said that the FDA registration is for a massage therapy device because they have different little tips, and some of the tips actually do massage therapy on the surface of the skin. So it depends on the application, I suppose.
Okay, so true plasma, skin tightening with different tips, could be massage therapy. There's risk of scarring. Is there similar risks with post-care high-risk scarring and patient selection?
Yes.
Any other risks that you can think of? Okay. Hearing none, we'll go to the next one. So I'm just going off of the CAE curriculum. Next one is non-ablative fractional collagen induction. So this is what's taught in the schools. So talk to me about that.
So you're talking about RF microneedling with the RF machine.
RF is on a different line. Aesthetic radiofrequency is different than non-ablative fractional collagen, according to the curriculum.
So there are two different ways to distribute RF energy to the skin. There is just a basic RF device, which is where I think you're seeing radio mentioned later in the curriculum. And then non-ablative fractional collagen induction therapy is essentially, it could be just basic microneedling as well. That could also fall under skin rejuvenation also. But it could also be the RF microneedling that I think it was Deborah that mentioned it.
Is the non-ablative fractional collagen induction a form of microneedling?
Correct.
Yes.
And tell me, is it only aesthetics or advanced aesthetics, or could it be a crossover device?
It is only
Both.
advanced aesthetics.
Both. I disagree.
It definitely.
Within the epidermis, it's a device. Within the epidermis, there, according to what our scope of practice is now, it should be considered based on definition to me that it would be crossover within the epidermis.
When working with fractional collagen induction therapy and you have that RF energy going down into the skin, it typically is hitting down into the dermis. And is also technically micro wounding the skin. Again, there's huge safety issues, post-care issues, client selection, very similar to.
We're not talking about radio frequency currently, are we? We're talking about just typical microneedling.
Non-ablative fractional collagen induction, which I've now been told is a form of microneedling.
Correct. There are multiple forms of microneedling.
It's microneedling.
So even if we're talking about just basic microneedling, the needles penetrating the epidermis, I think that in itself would validate it as a CAE device.
And who's talking?
That was me, Taylor.
Taylor, thank you. I'm just going to go around the room, which I keep saying, and then I stop. Sorry. Lacey, do you have an opinion?
Yeah, I do. I definitely think this falls within the COS device definition.
And based on it working within the dermis only, you think it could be? Okay.
Working within the epidermis. Only, correct.
Oh, sorry. That is what I meant to say. Olivia Hawthorne, do you have an opinion?
I agree with Lacey.
Olivia Nelson?
Yeah, I agree.
Pamela Sander?
I agree. I just wanted to clarify here. It's saying non-ablative fractional collagen induction. That's no heat involved, correct? Or is that,
You tell me.
Yes.
So why is fractional in.
Correct, which is why I think this non-ablative fractional collagen induction, I believe it's talking about both forms. I mean, and specifically the RF microneedling, because you have that word fractional.
I just think that poses some question. I mean, to me, that should not even be part of the language here. To me, that would indicate that there is electricity also, or heat. Am I wrong here? I mean,
Yeah, because then it would, if it was just microneedling, it would be non-ablative collagen induction. It's the fractional that I agree is the part.
Or is that right? I mean, I feel like the fractional is not, that would be micro under the radio frequency.
Right, I agree.
So are we going off, this is Olivia
This is
Nelson.
Deborah. I
Are we
think it's
going off
just
of-
because people call it.
Go ahead, Deborah.
No, I think the reason that it sounds confusing is that they say fractional or it's used in the aesthetics world, but yet, that when you're doing something non-ablative, that is not completely removing the epidermis, and it's that there could be interchangeable, but we're not adding RF to microneedling. So I think we could take the word fractional out and make it clear to everyone. I agree.
But are we just speaking to the advanced curriculum right now? Because maybe somebody could speak to that, what that means in that, when you're looking at it in that curriculum. Are we talking about regular collagen induction, or what is involved with that? Because if we're looking at the curriculum, then, does that make sense?
I have a school person, right? Lacey, you're from the school, an advanced aesthetics school, correct?
No, that's not me.
I'm from the aesthetic school. Taylor is.
Oh, can you answer that, Taylor?
I would think that if the word fractional, I do agree that the word non-ablative and the word fractional are often used interchangeably within our realm. So I think the fact that they are both stated within the non-ablative fractional collagen induction, that would mean that it is including radio frequency energy.
Right.
So then is there a spot that talks about collagen induction without that aspect?
It would fall under skin rejuvenation, I'm sure, because that's where we technically put it, like on our state sign-offs. We put all regular microneedling, basic collagen induction therapy under skin rejuvenation.
Okay, so then would that be like a crossover? Would that be considered a crossover?
I personally don't think it would. One, if the RF is involved, you have heat going down into the dermis. So they're right there. That rules it out as a COS.
So we should separate then the difference between collagen induction, just straight collagen induction. So we maybe need to break that down a little bit more.
So I think we should leave the word fractional. And that would be referring to RF microneedling specifically.
I have a quick question. Is there a device that's non-ablative fractional collagen induction that does not use radio frequency?
Not to my knowledge.
No? Was that no?
Not to my knowledge, no.
Okay. Anyone else?
Can you repeat that? Is
there a device that's...
What was your question there?
If there's a device that's non-ablative fractional collagen induction that wouldn't include radio frequency, could they be separate, or are they always together?
Oh, okay. I would think that they would always be together.
Because I think that microneedling devices don't always have RF with them, correct?
They do not.
They do not.
Right.
So then that would not be accurate that non-ablative fractional collagen induction is microneedling, correct?
I think it would be what we call RF microneedling.
So I guess wouldn't the question be, what would fractional, how else would you use the word fractional without RF? Is that even a thing?
That's what I'm saying. That's not even a thing. I feel like I mean, because like fractional and then having no heat, that just seems like that language does not together.
Yeah.
Because it does, fractional does have heat. That's the nature. There is no non-ablative fractional collagen induction device that would not have.
Whoever that was breaking up.
Okay, this is Pamela. I am not familiar with any kind of non-ablative fractional collagen induction radio frequency device that would not include heat. That's the nature of the radio frequency and the fractional. And
That is my understanding as well.
So am I correct in saying that the non-ablative fractional collagen induction, which uses radio frequency, would be in CAE, but there's a possibility, if you remove the heat, that it could be in COS?
if that is something that the device would be able to do, I don't know if that is available. Actually,
Would it be the
to remove the
device?
RF?
Typically, when you're talking about RF microneedling devices, they do not offer the option to do it without heat. But of course, there are basic microneedling devices that do provide services that do not include heat.
So, in my understanding, and everybody can agree or disagree, that the non-ablative fractional collagen induction radio frequency microneedling does have heats for skin rejuvenation, and that specific type of device would be CAE.
Correct.
Correct.
Yes, with heat.
Okay, I have two more questions. Is there a microneedling device that could be a crossover without radio frequency?
Yes.
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 And then my second question, and I believe this came up at the last meeting, is there a radio frequency device is there a separate radio frequency device from the one we just talked about that is used without microneedling?
Correct. There is. Yes, it is used for body contouring.
And would that be CAE or could it be a crossover?
It would be CAE.
Yeah, that's CAE.
And you said body contouring.
Body contouring and cellulite reduction as well. And also skin tightening, I suppose.
So there's no form of radio frequency that could fit into COS.
No.
I disagree with that. Depending upon the wattage and the applications of it, there's a lot of beauty type devices that don't even have to have registration. They just have to have listings with the FDA that are warming the skin, that don't penetrate, they don't heat up to the extent that some CAE devices would do. So I can't. That's an actual energy source, not necessarily a device. So we're putting all of those devices into saying that they all do those things when in fact they don't. Some of them, are very benign in nature. So I would say it would depend.
So it could be a radio frequency device with limitations for a COS.
Yes.
That's not what I wanted to do. And would you say that those limitations would be depth of skin?
Right. That's what I would be saying.
So
Strength and the
yes.
I mean, when you talk about depth of skin, when you are actually using radio frequency energy, for it to be effective, it has to hit the adipose layer or the fat layer of the skin for it to be considered an effective radio frequency treatment. So there would be no point on having it crossover if we know it's going to be hitting that adipose tissue. Because I mean, that adipose tissue obviously is well below the dermis.
And you, well,
If you're using one for contouring, yes, but maybe they're not using radio frequency for contouring. It's used for other modalities as well.
like,
You could do lots of different skin rejuvenation procedures, you know, product penetration with warming the tissue. You're basically heating the skin with radio frequency. When you target the adipocytes, then you're targeting, you know, body shape. But that's not necessarily what the energy does.
I don't know of any device that uses radio frequency just to warm the skin or to penetrate. Typically, that's more of an ultrasound device or some kind of nano device. The only radio frequency devices that I know of are FDA cleared for body contouring and cellulite reduction and skin tightening.
Well, the ones I'm talking about are more beauty devices, not medical devices. So a beauty, you know, maybe, you know, we could certainly maybe specify that's classified as a you know,
would it be
because it's
similar?
an energy, it's not a device specifically.
Is it electrical or mechanical?
Yes.
Yes.
Which one?
It's mechanical.
And would it be similar to galvanic current, microdermabrasion, high frequency, light emitting diode therapy, or microcurrent? Similar to any of those?
Yes.
Yeah.
Similar.
Similar to which one?
Well,
Microcurrent, you can do skin tightening.
And then are there any, what would be for COS? So it would be something that's warming the skin for skin rejuvenation. And there would be some limitation on the depth of skin, likely what's already in statute. And where was I going with this?
So for
Education.
product,
Is there safety risks?
In the COS scope that have radio frequency that are doing these slight treatments like that. I've just personally never heard. I just didn't know that was an option, or I've just never personally heard of any radio frequency devices that can do those things.
No, I haven't either.
I haven't either, but
definitely other
saying that
currents,
you
other forms of energy, yes, but radio frequency, the only things that I personally have seen, again, body contouring and skin tightening. Product penetration has never really, that I've seen, been used. Yeah, so I just would like to know what those devices are. I'm just curious.
Yeah, that's what I'm kind of curious about that as well. Deborah, it's my understanding that you know of some beauty devices that are
You can get online on Amazon and pull up 10 devices that use radio frequency for handheld devices for even home use for skin tightening and lifting. I'm looking at, 10 different ones right now. So I'm just saying it's an energy modality.
You can go on Amazon and get a lot of these things.
Correct.
Yeah. Absolutely.
And for
but there,
for
I mean,
cause, doesn't it only have to be
My friend
FDA
went on Amazon and got an IPL
Okay,
machine.
one at a time. I can't hear all of you at one time. One at a time. Taylor, go ahead.
Oh, no, I wasn't speaking.
Martha?
I'm good. I'm just curious on the devices and just because you can get one on Amazon doesn't necessarily mean that it would be, brought into a place and used for those purposes effectively. I guess that's mine.
So this is Olivia Nelson. That's kind of my question. Doesn't like for CAE, doesn't it has to be FDA approved, correct? But does it have to be FDA approved for cosmetology? And if it doesn't, couldn't you get a device like that and bring it in and use it?
I think what the differentiation between obviously the FDA being approved for CAE is one thing, but when we talk about only working on the epidermis, when you use radio frequency, it is going to hit the dermis. That is what it's for. That's how it tightens the skin. So it's going to be working on that adipose tissue. I have never heard of a radiofrequency device that only warms the skin. And we have to be careful when we use the word warms the skin, because we don't know how deep it's going. I mean, if you want to talk about lasers, technically they also warm the skin. So I've never heard of a radiofrequency device that is only used for product penetration or anything like that. I think that was the question we were asking, was, is there a specific device we know of?
I am not there.
I guess my concern in being involved in doing a lot of rulemaking over the years is that we put ourselves into a box with a modality. Because there may be a time when radio frequency is very much appropriate within the scope of COS, and we are saying that there's an energy modality that we cannot use or we're limited to based on our definition right now. And so I'm saying that there are a lot of radio frequency devices that are on the market that are safe for consumer use even. So I'm just saying that there are instances where, in fact, the safety issue that have physiological effects below into the epidermis, but basically they have safety guards that would be very appropriate. So I'm just saying that we have to think a little bit broader, in my opinion, that we don't want to be so, we don't want to limit a device, an energy or a type of energy versus saying, oh, this is one or the other. And that's what I'm saying. It's just, that's an energy modality.
And I think kind of going back, this is Taylor, kind of going back to what Martha was saying, is that there is laser hair removal devices available for consumer use. And one, we know that they're not effective and not safe, but two, we still chose to limit laser use to CAEs for a reason, regardless of if there was products available to the consumer.
I agree with Taylor. I think radio frequency can be very dangerous. And I don't think that just because there are some tools that are for consumers and are less intense, are less energy, or easier to operate, doesn't mean that it takes away from it being in our scope of practice as a CAE.
This is Olivia Nelson. So I'm looking right now. I pulled up on my phone I don't know how to pronounce it correctly. Reposage skincare brand. You can buy over the counter an LED radio frequency and EMS skin tightening machine. Anybody can just go to that website and buy it. I mean, is it going to be as effective as, radio frequency body contouring or skin tightening? No, but that doesn't mean, why should that mean that we couldn't use this specific device, just as an example, as COS, because it also has LED. It has EMS, and it's $150. So like, I agree with Deborah. I don't think that we should limit ourselves. That's kind of what we were trying to avoid doing. Because just because they're not common doesn't mean they're not out there. Do you want me to email that to you?
Tell me, this is Sammy, what are the risks to using radio frequency that you wouldn't buy on Amazon that you would use for CAE?
Burns, blisters, hyperpigmentation, scarring.
What's going on in all of the cool sculpting machines now? That was before the radio frequency. There was something going on with like there's something going on with the fat. I can't remember what was going on. That was before radio. It wasn't with radio frequency. Oh God, I don't even know what the point of that was anymore. Never mind. Ignore what Martha's saying right now.
And then can you tell me a little about what type of education you would need to use the type of radio frequency device in CAE?
Did you say Taylor?
Anybody.
Oh.
What kind of education, training? Would it be just manufacturer? Would it be, you need actual schooling?
Hands-on. It would be usually someone coming in when you purchase the equipment. They would come in, or when you're in a class training, you would usually do theory followed by hands-on treatments as well, depending on how many, like 15 to 25, I think.
Yeah, I think within the state right now, we require 25 body contouring, which we use radio frequency for. And then I think it's 15 cellulite reduction, which we also use radio frequency for.
This is Pamela. Are there certain strengths that denotes, I mean, obviously there are different strengths when it comes to radio frequency. Is that something that can be specified so that it's not just lumping everything? You know, that type of treatment, that modality, radio frequency in and of itself.
Like
different strengths that wattage under CAE versus COS.
Well, the goal is still supposed to be the same of radio frequency. It's, I mean,
correct.
So so I would say no.
Okay. Yeah. Well, that's why I'm just so curious about would they all be able to elicit the same type of damage?
Well, like
No,
Amazon
depends on the
radio
wattage.
frequency machine versus like a $100,000 radio frequency microneedling machine. No.
Right. So that's kind of that's what I'm saying. It's like there is differentiation here.
But then in theory, couldn't someone, since it's not, someone in cosmetology could go and grab an IPL machine off Amazon that's $150, and since it's not, I mean, what's the stop there?
No, because the statute says IPL is
prohibited.
But if you, I mean, I guess, yeah.
But then we get into it's prohibited for COS to work on anything lower than the epidermis, and radio frequency works lower than the epidermis. It's all the way down to that subcutaneous layer. Excuse me.
So it's like, even if the machine isn't made as equally and doesn't get down to the subcutaneous layer, it still needs to be in the scope of.
Sammy, maybe answering question 4 would be helpful.
Thank you. Question 4. Are galvanic current, high frequency microcurrent, light emitting diode, and microdermabrasion capable of further penetrating than the dermis? Is that right? Capable of penetrating further than the epidermis.
Epidermis.
To determine whether the COS device itself must not be capable of penetrating deeper than epidermis, or whether the COS device can penetrate deeper, but the COS esthetician using the COS device must not use the device in a way that could cause penetration further than the epidermis. And answer whether high frequency microcurrent and all of those are capable of penetrating further than the epidermis. So I think, based on what I'm hearing, is the radio frequency that's under CAE. Is there ever a time when that one could be used by a COS if it doesn't go past a certain point? Or is it always, no matter what, going to go past a certain point?
It's always going to go past a certain point. That's what the energy is for.
Then there must be something different in the radio. There needs to be a differentiation to the radio frequency device that's under COS.
That's what I was talking about, the strength of it. But
is there a strength, a wattage that you could reference in both of them?
I'm not familiar with that.
Can we come back to that, Sammy? Because I could reach out. I have a contact with the FDA, and I can ask Richard and ask him if there is a differentiation between a class 1 radio frequency device and a class 2 in the amount of energy delivered and the wattage of that anytime you put energy into the skin, it needs to have clearance or at least a device listing. So I'll, if we can find out the differentiation between a class 1 and a class 2, that might give us our answer.
Okay.
Because as we look at these devices, and as far as do they have I mean, LED is a biochemical reaction that has a It's made to do things below the dermis. So all of those things have an effect on the whole body. We are not a separate systems, we are a whole system. So even by facial massage, we have an effect on the circulatory system and everything. So our answer to that will always be, yes, it does have an effect, in my opinion. So saying that we can't do anything that has an effect below would make this really a difficult separation. But there should be limits. I'm saying, I agree, but I'm just saying, I think we can come up with maybe class 1 radio frequency devices would be okay versus class 2 based on energy.
Sorry, I'm typing, so I know what I'm doing. Well, so I know what I'm doing later. I can't spell, but that's okay. Okay, so I think we come back to radio frequency. I think it's fine to specify ones that we might need more information on. I think that's totally doable. The next one on my list is aesthetic ultrasound, and it's, yeah, that's what it is. Talk to me about that. Anyone?
That could definitely be a crossover device, again, based on classification. There are many devices, sorry, this is Taylor. There are many devices that use a very low level of ultrasound just to help penetrate product, and they're very safe. It's very difficult to misuse that device. And then we have devices that use aesthetic ultrasound like Ulthera that are extremely, they require a lot of training, a lot of in-depth knowledge.
So you think, so there is an ultrasound device that could be used for both?
Absolutely.
And would it be the same machine that where there's,
no,
you can place a limitation or you can go further, or would they be different machines?
They would be different machines. And I think too, it can go again, like on class verification. So if it's a class 2 device, a class 3 device, etc.
Okay, so tell me about the ultrasound device that would be CAE. What would be the risks, education, those types of things?
You can have, I mean, burns, bruising, blisters. Also, if you were to hit certain areas with certain nerves, you could cause permanent facial sagging, nerve damage.
What would the education look like?
I mean, typically it's a 2-day education. We do 1 day on theory, and then the next day is hands-on, learning how to read the ultrasound device, learning what not to fire over. For example, we don't fire over blood vessels or bone. Very painful and can cause damage, things like that. And then mappings of the face too. You have to map the face very specifically for that kind of ultrasound.
And then tell me about what that would look like in COS.
Education-wise?
All of it.
I mean, it's very basic. You're mostly using aesthetic ultrasound under COS. I would assume you would be using it to penetrate product. So you would apply a serum to the skin. You would apply ultrasound on top of it. Sometimes it can feel a little bit warm. But it's a very low wattage. And again, I think there would probably be a different classification as far as a class 1 device versus a class 2.
And I didn't ask this, sorry, but What are you using the aesthetic ultrasound for in CAE?
Skin tightening and facial lifting.
Okay. And you would really only be using the ultrasound in COS just to penetrate, to have products penetrate the skin?
That's really all I know of.
Would there be other reasons? Well, let me read the reasons that it could be. How about that? It could be cleansing, stimulating, manipulating, exfoliating, applying lotions and creams to the human body or face.
I would say it's, I'm sorry, could you read them one more time?
Cleansing, stimulating, manipulating, exfoliating, or applying lotions and creams to the human body.
I would say stimulating and as well as applying lotions and creams.
You're going to get blood flow, so, you know, stimulating is.
And tell me, what do I want you to tell me? Oh, is it electrical or mechanical?
Mechanical.
Electrical. Mechanical, electrical. Well, it uses electricity.
It can be both. Could it be both?
Isn't it?
Yeah.
I don't know if it has batteries, I suppose.
There are devices that use batteries as well.
Yeah.
And so these, let me just verify, these would be two different ultrasound devices.
Correct. And you could even, to my knowledge, the only advanced ultrasound device that is used and FDA approved on the market is called Ultherapy. So you could even specify that on there if you wanted to.
I have an ultrasound device for body sculpting. That's not all therapy, so.
Is that one considered a CAE or COS?
CAE, yeah.
Okay. I think
Because you can also do cavitation with ultrasound.
cavitation. That I get
That's
asked about cavitation every day.
Dialysis, cryolite.
Every day.
You what?
I get asked about
Sorry about that.
cavitation every day, and I don't even know what it is. In fact, I got it today. Let's finish down the list. So do you think that there could be device classifications for ultrasound that would differentiate between the two?
Yeah,
Did I
absolutely.
hear that?
That's definitely what I think.
I agree.
I'm not going to lie, it scares me to hang the hat on FDA classification of devices. It really does. But I'm willing for you guys to go forth and conquer and bring it back to me.
Maybe not in everything, but certainly in certain things that might be our only option to give the scope enough leeway to be able to use a benign energy source. Because we're talking of an energy source, not really a device in particular. And that's my concern.
But if the device does that energy, isn't it similar? Isn't it the same thing? I mean, how do you rectify that? Or that's not the word. What's the word? There's a word. How do you make them,
Well, a device is a specific one, but the energy that it's used is radio frequency. So it could be used in many, many different ways and not just one device.
But I think when it comes to making decisions and making rules, obviously we're not going to have the capability or the time to go through and list devices under every single category. We sometimes have to just list that energy as it is.
and that's why it's listed in the curriculum because of that fact. But I also think that there is, maybe, Heather, can you weigh in on this? Is there radio frequency that may be medical and that wouldn't be in the scope of CAE or COS?
So
Yes, there
I'll
is,
be
if you're talking about.
if it doesn't fit the CAE guideposts, then it would be outside of CAE. Now, COS can't do medical. It has to be for beautification, as it's stated in the statute. So it would need to meet that guidepost. But for the CAE, I think what we would need to focus on there is that it meets the guideposts because they have that other statutory provision that takes them out of medical, the medical prohibition. So that's why we need to look back to the guideposts. Does that make sense?
Hyphacator would be one that would come to mind.
What was it?
The hyphacator, it's used in dermatology for lots of different, removal of skin tags and cautery and all of that.
And it uses radio frequency?
Yes.
Lots of pickle. So how would that work if there's seemingly 3 different types of RF energy devices?
The hyphacator that's out of a CAE scope anyway.
Correct.
Right, but what I'm hearing is there
intended
is
use.
potentially 3 levels of radio frequency. How would we differentiate that?
Well, and I think this goes back to laser use often as well, because there are lasers that are out of a CAE scope of practice.
Yeah. CO2 laser.
Yep. So we can only use certain types of lasers. We can't use a fully ablative. So it's kind of the same concept of we have limited availability. And I think it would be the same with RF as well.
Okay, we'll go back to that one again. Okay, do we feel like we're going to check ultrasound and see what the FDA says about class specifications? Yes.
Yeah, I think that would be fine. Or, I mean, just really going back again on what the device is made to do. If it is made to penetrate product, that would be fine. If it's made to cause facial tightening and facial lifting, it would fall under CAE.
So intended use.
Yeah.
Yes, because my ultrasound is used for dilithermy, which is, going to be for fat loss, inches lost.
Well, would that one be, in your opinion, COS or CAE?
Oh, CAE for sure.
Okay. Good, that's what I wanted to hear. It's later. Okay. So for, that's not what I wanted to do. For ultrasound, could it be same thing with radio frequency intended use?
Mhm.
And can't there be, even though its intended use is X, can't there be off-market things that you would use that same device for? And so would that really work? Like prescriptions, you can get a prescription, atenolol was originally used for high blood pressure, and now they know it can be used for anxiety as well. But the intended use originally was for high blood pressure. Isn't that the same with devices?
Well, I
You're
think
saying
that's
off-label.
Off-label, thank you.
And I think that's hard to talk about with COS because COS doesn't have that FDA sticker in their definition, whereas CAE, we can only use a device for what it's intended for. That is legally within our scope, but we cannot use things for off market.
We, in basic, which we all are too, we do have the, we have to follow all state, federal, whatever guidelines, and that includes the FDA statement within our basic anyway. So we all are following the FDA guidelines.
But a basic device does not need to be FDA approved.
I would refer that back to Sammy.
Today, no, there's no requirement.
Approved or registered are different things. It has to be
Neither.
FDA registered, anything that.
Neither in COS at this time. There's no FDA requirement. There can be, but there isn't.
In our ethics, following all state and legal, whatever, isn't it within the ethics area?
I don't think
Another
so.
discussion, another day. We'll go through that another day.
Okay. Let's see. Am I losing myself here? Let me see. Okay. The next one, oh, we already did that one. Microwaves, energy.
Oh, microwave energy is used for hair removal. I'm going to say it's not a common practice. It's also used for hyperhidrosis, which is excessive sweating in the underarms. And that is not something that I am trained on. That's not something we train students on. So I really can't speak too much about that.
Is there risk with that, using a device that has microwave energy?
It's very similar to laser. You could have the risk of burns, blistering, scarring.
Is it similar, would you have similar education as lasers?
I would imagine so. Yeah, I would imagine it wouldn't be too different than working with a laser.
Would there be, would it ever be in COS if you use the guideposts?
I would imagine not. Just because of the similarities that it has to laser and IPL energy.
Anyone?
Say not.
Yeah, I would agree. I think it goes down to the follicular area for, heating it up and disabling it or working on sweat. So.
Okay, that one was easy. And then it's emerging technologies. So and obviously you guys can tell me what those are. Do you want to add some to this list, devices that I don't have, or and- hold on, I gotta look at this email here. Hold on here. It's the question I got today.
The only one I wonder about the, the EMS technologies, that are used for body contouring or body muscle, working the muscle. I don't know where those fall. I'd like to see if anyone has opinions on those.
So this morning I got a question about ultrasonic cavitation. Where does that fall in our list? Is it under ultrasound?
There's sound. Yeah, that's like the diathermy, or not. Yeah, it's done with ultrasound to cause cavitation.
So it would be COS.
And it would be advanced, in my opinion.
Anyone else?
I agree. I think most forms of cavitation should fall under advanced.
Are forms of cavitation always ultrasound?
No.
Good to know. So I'm going to put it as its own. Is that okay?
Yeah.
So it can be ultrasound. What else could it be?
It can be acoustic wave.
Anything else?
Not to my knowledge.
What are the risks to using cavitation?
I have never used ultrasound for cavitation, but with acoustic wave, you've got bruising, blood vessel collapse.
Skin dimpling.
Mm-hmm.
Do you think it's similar to lasers or IPL as far when you're dealing with risk or even education and training?
I think education and training, absolutely. Risk, I would say.
I work for a company that has acoustic wave. Yeah, sorry, go ahead.
I was gonna say, I think there's less risk associated with acoustic wave or just cavitation in general than laser, just because you don't have that heat aspect. But again, I've never worked with ultrasound cavitation, so I can't speak to that. I'm only talking about acoustic wave.
But
yeah, there's a lot less risk with acoustic wave.
So would acoustic wave still be CAE or could it be COS too?
I think it can be COS as well. It's the device that I'm associated with or that I'm familiar with is a class 1 device. It's considered actually more of a massage therapy device based on FDA definitions, but you can change the heads on it, which would make it, a different appropriate for different indications. So I think it could be both, but it would be based on what you're using it with and intended use. With acoustic wave.
And Sammy, am I correct in thinking, I don't know if maybe I just made this up somewhere. Am I correct in thinking that COS can use any class 1 device, that's just class 2 where you get into that being only a CAE device?
No, that's not written anywhere in rule.
Okay.
So so cavitation using acoustic wave only, you think is in COS?
I think it's more not necessarily causing cavitation. It would be more of a cellulite treatment when you're using it for COS, not for cavitation.
Okay, let me ask you this. Where does cellulite reduction fall in to
Both.
cleansing, stimulating, manipulating, exfoliating, or applying lotions and creams.
It could be all of that, except for the exfoliating. Well, yeah. I mean, there's all kinds of cellulite treatments that are done in all of those different.
I would agree with that as well.
Keep losing my place. What would be the risk on the cavitation using acoustic wave?
Bruising, blood vessel collapse.
Same?
Yep. Well, that's acoustic wave only. I don't know about the ultrasound.
Wait a minute.
Again,
Yeah, you confused me. I thought the acoustic wave was less risky.
Correct. Those would be the only risks.
Those are the same risks that are with. Wait a minute, where is that?
and those are at those settings would be based on different settings. I would think that there would be, I don't necessarily, I mean, if you're using it for cavitation, you might get those, but for cellulite reduction, I don't know that you're going to necessarily, but I guess, you could.
I have personally had that treatment and I bruised like crazy and it was for cellulite reduction. So I can personally attest to the bruising.
So based on that, do you still think the acoustic wave cavitation is really okay for COS to use?
I think it depends on the settings. I mean, well, the device that I have, I've never bruised anyone with, and it's a class 1 device. So, and it also does facial treatments as well. So depending on the settings and the acoustic tip that I put on, it would, certainly be operator dependent, which reduces any of those, those would be unwanted side effects, and that we would be rare with the one I have, but.
Okay. Are there other devices that were missing in CAE?
Did we want to jump back to basic microneedling devices? I don't think we ever actually discussed that one.
Yep. So a basic microneedling device not using radio frequency.
Correct.
We believe would be a COS and a CAE device.
I personally, Taylor, I believe that it would be a CAE only. All microneedling devices that I have worked with are class 2 devices.
The classification is not the prerequisite of whether or not, because so is it LED. So if we are going to go by classification only, then it would be out of scope to use an LED. I think within the epidermis with proper training, it is sufficient, and it is totally within the scope of a COS, personally.
I agree. This is Olivia Nelson.
This is Pamela Sander, and I agree. It's within COS.
Sonia, do you have an opinion? I haven't called on you.
Yes, sorry. I just had to unmute myself. This is Sonia. Yes, I agree that it's within COS.
Olivia Hawthorne, are you still on? She may have had to get off. Where's my list? Yeah, she had to get off at 11:30. Okay, who's next on the list? Lacey? Lacey, do you
Hi,
have
I
anything?
agreed that it was in cause.
Martha?
If it's used within the epidermis, then yes, I agree that it's a different cause.
What am I missing? I don't think anybody. Can you guys tell me what are the risks for using a device that would only, or using a microneedling device within the epidermis? What would be the risks of to a client?
The thing that gets complicated with microneedling and only using it on the epidermis is when you're using the device, you have to set it at very specific depths, like the needle depths as far as how they're going. So I guess my question is, how are we going to control people only working on the epidermis? And then also the association, you're guaranteed almost every single time to get bleeding. And I know that like first aid and bloodborne pathogens is not required for your basic license. So that's something to think about.
I think what is it in California, it's only like nano needling, so it's 0.25.
Correct. So I've seen like, and typically the pens will come with different tips. Like there will be nano tips that come with pens, and then there will be separate tips that are actual needle tips. And to my knowledge right now within Oregon, the nano tips are allowed.
Right. That's what I understood as well for cosmetic, is that nano needling is fine. Yes. But it's just, as you know, like when you're microneedling, if you push too far, you're going right past that 0.25. So it really is. Yeah.
This is Olivia Nelson. So I think that we need to have training, because I've microneedled lots of times and I don't cause bleeding. I do it till they're red. So I think it depends on how much training you've had. And I mean, there are a lot of factors, but training, I think, is something that we need to put in there. And I don't think we should go on California, because California has really narrowed a lot.
No, just for an example of how they have separated, so that or a potential how we could separate. I don't even think aesthetics can do anything, or estheticians can do anything other than nano needling in California. Obviously, that's not how our state operates, but it's an interesting way to differentiate between the two.
And I think that is how we currently differentiate. Is it? Yeah, okay. I'm almost positive that basic estheticians under COS can nano needle with no problem.
And that's just a point. That's just 0.25, correct? Nothing
negative. No, not true.
No.
Is microneedling not regulated?
I think that with I've been doing and teaching microneedling for many, many years. And I teach blush, not bleed, because it's actually counterproductive to draw blood. The other thing would be that, we don't tell people that when they're dermaplaning that they can only use a razor blade that can go down to the epidermis. You have potential in everything that we do for greater harm, and that's the professional liability that we face to stay within our scope. So by saying, how can we make sure they don't do that? Well, we're all professionals, and then that you get cited and you get insurance, whatever, but we can't say everything that we do, we're going to manipulate it so that there is no harm, because that's just not what we can do in our practice. So, if we have a guideline that says in the epidermis.
It's almost seeming like there's just going to be a gray line, and then it's seeming like it's wanting to be, well, estheticians can kind of basically do everything, they just have to be careful. But it's like there has to be some line drawn to where, yes, this is a certified advanced esthetician treatment, and this is an esthetician treatment. And so there has to be.
I think that line is that within the epidermis.
There has to be some crossover.
Yeah.
But I think when you
That's
get
exactly
into,
right. We have crossover in some things.
when you get into specifically talking about microneedling, you are essentially wounding the skin. That needle is penetrating the epidermis, which to me goes against what is available within the scope of practice as a cause.
Agreed. Like in my office, there can be treatments with microneedling it depends on the patient and the person. Some people can bleed profusely at the same depth as someone who's not going to bleed at all. So it
Which is why
varies
training
person to
is
person.
important.
Yeah, hence the training.
And this is Pamela.
Right.
Yeah, I absolutely agree that it should stay within COS. There are, if you look at microdermabrasion, that's something that if you continued and went over an area for a long period of time, you're going down very deep. And that is under the expertise and the control of the operator. So that's where I think that it's really, yes, there's a lot of different machines. There's a lot of different devices out here that can cause harm. As practitioners, that's where we need to take caution. And it does involve adequate training. And, when I do microneedling, even though I'm CAE, I don't even draw any blood.
Yep.
And that's how I trained.
And again, I think we need to go look at the legislation that says that we can work within the epidermis. And I think I agree with Pamela that it comes down to education and training and just staying within what statute says, which is within the epidermis.
Sammy, it would help me if we answered questions. Maybe if we went through each person and got answers to question 4.
Okay. So I'm going to go with Sonia first. The first question is, are galvanic current, high frequency, microcurrents, light emitting diode and microdermabrasion devices capable of penetrating further than the epidermis?
Yes, they are. Some of them are.
Yes.
Which ones?
Light wave microdermabrasion is capable. I don't quite remember, so I won't speak to on galvanic current. And I know but definitely light emitting diodes and microdermabrasion, I'm very familiar, can go down further. And we use them commonly and only stay within our scope as a COS.
What about galvanic current?
I'm not it's been so long since I've used galvanic. So I'm not able to say enough about that right now.
What about high frequency?
I don't think so, but again, we use high frequency for after extracting just to clean the skin, so no.
And microcurrent?
I have never used microcurrent.
Okay.
Yes, I believe you can, because it does go down to stimulate the muscle.
So it can go beyond the epidermis?
Yes.
The effect.
The effect of it can, yes.
The effect, yes.
I think it comes back to stimulating the natural biological effect and the health and beauty of the skin.
Do the others agree, or is there any different opinions on that question?
This is Pamela Sander. I agree with that.
What about high frequency?
High frequency, I know, is used post extractions, and I'm just trying to think where that.
Personally, I feel like high frequency is just like oxygenating the tissue. I don't feel like it's going down deep into the tissue. It's oxygenating the surface.
So it doesn't go beyond the epidermis?
Antimicrobial, antibacterial.
I don't believe it does.
I know.
I think there are effects below.
I think there are effects below, but I as far as depth, I'm unsure as what the actual physical depth is.
And is it safe to say that with microdermabrasion, it does go, the natural physiological effects can go beyond the epidermis?
Yes.
Yes.
And same for light emitting diode therapy?
Yes.
Yes.
And what about galvanic current?
Yes. Natural.
Okay. What do you use light emitting diode therapy for?
Reducing inflammation, helping with acne and sebum production. They can help hyperpigmentation.
Calm and soothe the skin.
Say that again?
Calming and soothing. Calming and soothing, yes. Actually, I'm oncology certified, and red light LED therapy is something that is indicated for even within oncology.
It stimulates a wound healing response. It activates your bone marrow derived stem cells. Non-inflammatory.
New question. Never mind.
Can I just clarify? Yeah. Thanks. So from what I was hearing, there is microdermabrasion, high frequency light emitting diode effect, and microcurrent. Oh, I'm sorry. Let me rephrase that. Except for high frequency and galvanic current, the other devices have the capability of going below the epidermis, not just the natural physiological effect, but those devices could actually go further, depending on how the esthetician uses them. Is that correct?
You're saying which ones were you specifically asking about? Microcurrent and?
So except for, so microdermabrasion, I think it was mentioned, light emitting diode and microcurrent, that each of those can go further than the epidermis depending on how the practitioner uses them. And that it's not just the natural physiological effect that can go beyond the epidermis, but the actual device, how the practitioner uses it, could go further.
No, I think that is the physiological effect of it.
Right. Yeah. I would say, with the exception of microdermabrasion, that can actually harm, whereas the LED and microcurrent, it's the side effect is that it can affect other tissue, but it's only.
I think we should
only.
Sorry.
I feel like, yeah.
I think we need to be careful to separate between microdermabrasion and dermabrasion, though.
Well,
because microdermabrasion, you're supposed to be just on the outer layer, but dermabrasion is something that we shouldn't be doing.
Correct.
Correct. However, with microdermabrasion, it's the practitioner. If the practitioner goes too much in one area, then you can just keep going down, and cause quite a lot of damage.
Correct.
However, it's completely that it's completely within the scope of COS.
I think that
So that's what
I
I'm
agree.
saying.
That could be done with a lot of things, though. I mean, you could also wax somebody over and over and over in the same spot, and that could happen too. So I think that comes down to, you know, using our brains as, you know, as estheticians and doing it how we're trained to do it.
Absolutely.
I agree.
Okay, so I think what I heard is that out of the list of galvanic current, microdermabrasion, high frequency, light emitting diode therapy, and microcurrent, just looking at those, that there is a few of those that the device can go below the epidermis depending on how the practitioner uses it, and that it's not just the natural physiological effect that goes below it, but depending on how the esthetician uses it, it could go below the epidermis as well. So if that's incorrect, please let me know.
Could you repeat that, please?
Sure. I'm trying to draw a distinction between whether the esthetician is how the esthetician is using these devices. Okay, so with those items, galvanic current, microdermabrasion, high frequency, light emitting diode therapy, and microcurrent, is it possible for any one of those to go further than the epidermis if the esthetician uses it in the way that it goes further than the epidermis, regardless of the natural physiological effect? We're not talking about natural physiological effect. We're talking about the device that the esthetician uses. Can she or he use it in a way where it goes below the epidermis?
I think the only one that would fall under that category would be microdermabrasion.
Yes, I agree.
That's what I say as well.
Because all those other devices, galvanic, high frequency, and light emitting diode, it's more so the actual energy that's penetrating deeper. The esthetician has no control over that. That's just the natural effect that it has. Microdermabrasion, if it is done incorrectly, absolutely, you can go beyond the epidermis.
Okay. So you made a differentiation between the light.
Any of the energy devices, so galvanic, high frequency, light emitting diode, and microcurrent, those are all using a specific energy that is going down into the skin. But it's, I mean, unless you're like hitting your client with it, right? There's no way for you to get it below the epidermis. With microdermabrasion, there is that risk.
Okay, so, but with those, since you made that differentiation, let me ask you, the energy from those devices can go further than the epidermis if the esthetician were to use the energy that way. It could go. It doesn't automatically get limited to just the epidermis.
I'm not sure. Wait, can you repeat the question again?
Yes, high frequency, you certainly could. You increase, you know, blood flow and circulation.
And so that blood
and
flow
it uses
and
heat.
circulating. I'm sorry, go ahead.
I mean, I guess the hardest thing for this is that we are not, we're a system and everything affects it. So is it a, are we, anything that we do is going to have a cause and effect. And the high frequency machine, depending on how long you do it and your procedure, will have an effect maybe slightly different. Is it the machine capable of that? You could certainly do an over treatment or something and have the dermal, you know, tissue heated beyond what we should. So I guess any device, if used improperly, could certainly maybe, I guess that's what I'm hearing you wanting us to say, that it can or can't. Is that correct?
Yes, I'm trying to understand whether the energy from the devices that were specified, whether that energy with that use of the device could possibly go below the epidermis.
Correct. And I think the distinction needs to be made that with galvanic and possibly high frequency, I know we said we weren't sure about the depth of that, light emitting diode, the point of using those devices is that that energy does enter the skin. But as far, and like, obviously, I'm sure with, I don't really use galvanic and I don't use high frequency, so I can't attest, but you can turn up those settings, absolutely. Like Deborah was saying, to a point where it's doing more harm than good.
They're an electrical current, so yeah, I suppose if you misused it, it could.
And that also goes with high frequency. You could overuse that and you could literally cause necrosis. But there again, it's the practitioner that's using it, sparking it, using it just in a certain length of time over a certain area.
Thanks. I think that's helpful for me. I think what I'm hearing you say is that if we look at the guideposts under the COS guideposts, and we go towards the bottom where it says to be determined, and then it has a 1 and a 2. I think that what I'm hearing is that you all agree with 2, that those devices, galvanic current, microdermabrasion, high frequency light emitting diode therapy, all have the potential to extend further than the epidermis. And what you're saying is that as the COS esthetician who uses one of those devices can only use it within the epidermis. Is that what you're saying?
Yes.
Thanks. Thanks for the clarification.
Yeah.
Can you guys hear me?
Yeah.
Yes.
I got booted. Sorry. I'm on, Nate, so can you still record? Is the little thing you're on? I don't know. Yeah, it's on. Hold on. Currently, we're not recording, so hold please. Is everybody going to be okay with ending the meeting at 1? I think that's a good time.
Yep.
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 Yeah.
Mm-hmm.
Yes.
Still nothing? Okay. Okay, so we're recording again, sorry. I was asking if you could draw the same conclusion based on how the practitioner uses the device. This could go beyond the epidermis, which is outside the natural physiological facts. Could be drawn with the fiberglass pen and the radio frequency device that's sold on Amazon.
Yes.
don't know why it's doing that. Ugh. Okay, well, we get the gist.
Sammy, I don't know if you wanted to share your screen, but when it bumped you out, it took your
Sorry.
screen down. That's okay. Just want to make sure you were aware.
Was not aware. We good?
Yeah.
Okay. Oh, why am I? Would you draw the same conclusion to the aesthetic ultrasound that would penetrate product, very low wattage, stimulate, and apply lotions and creams? Or would that one just stay within the epidermis?
I think the natural physiological effects will penetrate below.
But can it go further than the epidermis and not? Yes.
Depending on the settings and the machine.
And same with a cavitation using only wave, acoustic wave.
Yes.
Okay. 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 Where were we at?
I think we were talking about just basic microneedling devices.
So, I was going to ask, do you think, and when we did rulemaking a couple years ago, we did discuss nano needling, putting that in the rule for regular COS. We ended up pulling it back because, we got advice and different things and, how microneedling was being classified by the FDA. Would it be safe to say that nano needling could be in COS? And
Absolutely.
Or would that be too limiting?
Nano needling is basically exfoliation. You're not doing any cell signaling with nano needling, so.
So what would, so the exfoliating falls within COS. What about, so if the other, is microneedling and nanoneedling separate distinctions, right? Is there any other distinctions?
Yes.
I think, this is Pamela Sander. I think with nanoneedling, basically it is the depth consideration.
What would the depth, could you draw the
Well,
same conclusion that the depth would be the same with a microneedling
0.2.
device?
I'm sorry. Yeah, actually it could be.
And what would that depth
Absolutely.
be?
So, I would think it's probably 0.25.
And would that be a good distinction to make in the rule? That you can use a microneedling device for under COS if you don't go beyond 0.25?
Yes.
No,
No,
no, because that's not doing any cell signaling. I think it should be not beyond the epidermis, which would be probably, I'm thinking that as long as you're at 0.5, you're actually going to do cell signaling and get a good treatment in. So anywhere, at the maximum it would be 1.0, but I would say that most estheticians, COS, would be working at 0.5.
Within the realm of advanced aesthetics, I do
well within the epidermis.
I mean, microneedlings are basically my bread and butter. I do a lot of them. Being at a depth of 0.5, I get significant bleeding with the pen that I use. And it's still a beautiful treatment and it's great. But even at a depth of 0.5, you still have that factor of bloodborne pathogens, safety and sanitation that there's not training on in a COS license.
which is why I think we need
Well, there
additional
isn't
training for microneedling.
There's other factors besides needle depth that come into play with microneedling as well. It also is within the RPMs and a lot of other things that can make your treatment more aggressive. So it is within the training.
But not every pen is going to be, every single pen is different. So stating it on RPMs or things like whether the needles are micro needling or nano needling, it's kind of hard because then we would have to go down the line of every single situation of microneedling, and it gets kind of tricky.
Exactly.
I agree, and to
Again,
that,
That's why we have the epidermis.
right, everyone's depth of skin, thickness of skin, it varies a little bit to each person. So I agree, it's kind of, it's very difficult.
And I think too, I mean, at some point when it's like what we talked about earlier, at some point you do have to draw the line, because if you're going to make a rule, if there's all this gray area, that's when you get people and practitioners who are confused. They don't know what is within their scope and what is not within their scope. And I think
by
that's what we're trying
statute,
to
that
avoid.
line is the epidermis. So that's kind of what is the difficult part here, which is why I think we should just add in a rule for additional training for microneedling like we've done for peels and for dermaplaning.
And also back in the day, microdermabrasion. I mean, now it's just standard, but when it first came out, that was not the case.
Well, new question. Would you think we need to make a rule for all of these devices, like dermaplaning?
No. Like additional hours of training, you mean? For all of these?
Oh, I see what you mean. Well, would it be to the benefit of the practitioner and the public to say you must have X amount of hours using cavitation device, acoustic wave only?
I think that's difficult because once you start cherry picking of what we want additional hours for, at some point, the certified advanced esthetician license almost becomes null. Because if you can cherry pick what you want to add to your menu, it's essentially like my license no longer exists. Does that make sense? It's like you would just basically
Yeah, it does.
Menu.
Probably if a radio frequency line, and so some radio frequency machines are for COS and some are for and some microneedle devices are for COS and some for advanced, and then it's just exactly at what point is an advanced esthetician's certification become not null?
Well, the point in this and the reason that we're doing this is because when the certified advanced licensure took away basically the device usage from the basic scope because of the verbiage. So we're trying to define now what is it, and it should not be us against them. I'm a certified advanced as well, but I believe everyone should practice at the highest level possible with training, and to pigeonhole basic estheticians into putting lotions and creams on, I feel is wrong. And I think that with training and professional, in all of these things, we have professional guidelines that need to be done. So I think that, practicing at the highest level in both basic and advanced is important, and regardless of, crossovers.
But I think too, if you start cherry picking and adding what's going to require additional hours, it sincerely just kind of invalidates the entire rule that went into place for advanced estheticians. That rule went into place for a reason, for safety measures to protect the public. And once we start adding these new things, I think we get into the realm of people are going to be doing things incorrectly and people are going to be doing things unsafely.
Why so? I don't really agree with, because I can remember, back in the day when microdermabrasion came out, there were like similar discussions. So I don't know. I don't quite agree with that. So could you explain that further?
I just think unless you have a hard line drawn in the sand of this is what is allowed underneath the scope of your practice and this is what's not allowed, you get the people who are going to take advantage of that gray area. And that's when you put the public into harm.
I don't know why they would necessarily be taking advantage of anything.
Yeah.
Rules are generally written for bad actors, not good actors.
Right.
Just FYI.
There's always going to be people that do things that aren't professional or outside of their scope, and there's no way to prevent that. And you have professional conduct within if you want to keep your license and have your insurance, but to protect your own scope above somebody else's, or worrying about that is, I think, not what this was intended for. This was intended to get the devices that are used in aesthetics defined, and if we need to add more training to keep it within what the rule stated within the epidermis, then we should do that if that's necessary. But I think that we have to remember that working within the epidermis was the intent of the law.
Yeah.
Right.
Okay.
Sammy, maybe it would be helpful in terms of, and maybe we do this next time, but in terms of microneedling, to say whether it has the same qualities in terms of risks as lasers and intense pulse light, and the same qualities in terms of the training as a laser and intense pulse light, or whether it shares common characteristics to galvanic current, high frequency, and those listed in terms of risks and training. That might help to see how it compares in the guideposts.
Anything? Anybody?
Definitely not the same as laser and light would be, because you don't have the risk to eyes. It would be more, you could do the damage with the microdermabrasion, or you could create a wound. And you could be more ablative with microderm, an aggressive microderm treatment than you can necessarily when you're doing a microneedling session that is done appropriately. So I would say it is less risk for sure than.
I think there's definitely more risk involved. I wouldn't necessarily put it in the same category as laser and light, because like Deborah said, you don't have really that risk to the eye unless you're obviously holding the needle over the eye. But you do have the risk of intense scarring if it's done incorrectly. You have the risk of hyperpigmentation if it's done incorrectly, if it's done on the wrong clients. And then again, preparing practitioners for what to do and how to handle blood correctly is a huge part of it, because chances are you are going to get bleeding. One client might not bleed at a certain depth, and somebody else would bleed significantly at that depth. And being able to handle that and dispose of those things properly is really important.
But we also have to dispose of blades properly for dermaplaning as well. So, I mean, there is a possibility of blood exposure with dermaplaning. I mean, it's rare, but there is a possibility. So you do have to have that same knowledge and carefulness with dermaplaning as you would with bloodborne pathogens.
With extractions,
I would
you know,
agree,
extractions
but I
can
would
draw
not
blood.
say that
So
it can be to the degree of blood and microneedling. And just for personal, in my office, I deal with probably, compared to surgeons or nurses or MAs, just with microneedling alone, I'm dealing with more blood than anyone in the office. So,
And your chances of having somebody bleed during a dermaplaning are far, far, far slimmer than having somebody bleed over their entire face during a microneedling.
well,
The
personally, I would
board
say
has
that's,
rules on
I
this.
never have problems with bleeding. It's in the
Cosmetology,
training.
I mean, just because someone bleeds doesn't make it inadequate training.
No, but when we're talking about staying within the scope of the epidermis, that would be adequate training. So the adequate training for COS would be staying within the epidermis, which would not.
Right, but you guys said that staying within the epidermis,
Right.
the depth of like 0.5 would be acceptable. And I have had many clients bleed at that depth.
Same. When collagen and when everyone is having really good circulation, stimulating, I get really responsive clients when I'm doing microneedling series.
Absolutely, especially at a depth of 0.5.
Well, I think that would be in your consultation to know the thickness of your client's skin. So saying we don't need to set a depth, we would say within the epidermis. And then when you're doing your consultation with your client, you would say you have a thinner skin person, you're going to start at 0.25 and then possibly work slightly up so that you are staying appropriately within the epidermis.
Agreed. And the face has different layers or levels of skin depth all over. You've got your eye area, which is super thin. I mean, to do a 0.5 there, that would be very aggressive.
Yep.
There'd be a lot of bleeding. Or lips. Yeah.
So I don't think that we should go down to limit ourselves as far as the depth of needle. I think I agree with what Deborah and Pamela have said with, you know, consultations and adequate training. And like what Lacey said, staying within the epidermis, the training for that. And can't this be, you know, can we refer to our number 6 and as far as it being a crossover device?
I just think the risk that it imposes is far more likely to fall under a CAE than a COS.
I agree.
I think all of the risk factors are equal to many other things that COS does, and that you're singling out a certain procedure more so than others personally. So I would say that it fits within the scope of the rule of the new law.
Right, but I'm singling out this procedure because I feel that this singular procedure is more dangerous than the others that we've talked about.
I think we could also, again, go back to the chemical peels and dermaplaning, and that's sort of the reason why, you know, 2 years ago or however long ago it was, that we did implement the additional hours of training was because of the risk. So if we look at it that way and look at the past of what we've done as far as implementing rules, I think that this would be in line with that. I mean, with dermaplaning, you're using a blade. I mean, so there's definitely a risk there.
Yes, I think that if we put in adequate training that's required, then I think that should be sufficient.
I agree.
I agree.
No, agree.
okay, I think me and Heather can work with that. Probably. I don't know, this might be a good stopping point and then have public comment. If there is any, I don't know if there's anyone on the phone. I think we've got a lot of stuff here. And Deborah, you volunteered to look at the FDA classifications.
I'm going to do that.
Okay, I put you down. Yep. That's your homework.
Okay.
And you're going to send it to me and then I'll send it out to everybody.
Okay.
Okay. Is everybody okay with stopping now? Feels like a good spot.
Yeah.
Yes. Yep.
Okay, where's my thing? Hold on. Gotta get everything out here. We're not going to do fiscal impact. We're definitely not there yet. Homework, Deborah and me and Heather.
Yep.
Public comment. At this time, the Board of Cosmetology and Board of Certified Advanced Estheticians Rules Advisory Committee will hear public and interested parties' feedback. Members of the public, please wait until you've been recognized. Once recognized, please state your name and affiliation to the committee for the record. Is there anybody on the phone? Anyone?
This is Karen, and I don't have any public comment, but I think what you're doing and how you're going through it is really great and will be very helpful in the end.
Okay, that was Karen Chambers, and she doesn't have any comments, but she thinks the work we're doing is very good, and it'll come out good in the end. Karen Chambers from HEC.
Thanks,
Anybody
Karen.
else? Is there anybody else on the line for public comment? Hearing none. The Board of Cosmetology and Board of Certified Advanced Estheticians Rules Advisory Committee is now adjourning at 12:39 p.m. Okay, I feel like we did some good work here today. So you guys are off the hook. I don't know that we'll meet in December, probably after the holiday, but we'll have April get back to you once me and Heather do an assessment of all this stuff. Is that okay with everyone?
So this doesn't have to be done by January 1st?
No.
Okay.
No.
Okay, good.
Okay, so I will have April reach out to you guys once we get a better grasp on what we need to do. Is that okay?
Yep.
Yes.
All right, then. I will talk to you guys later.
Thank you.
Thank you.
Thank you. Bye.
Bye.
Okay.